Hi, this is Aisha for VETT222. I will be doing task 15 right now, which is the fecal flow by centrifugation. So we're going to take our tube. Before we start, we need to make sure we put on our goggles. Okay, so we're going to take our tube and our fecal sample. Use about a quarter of a teaspoon of the fecal sample. So I'm just going to take a small amount, put it in our tube. Try it again. There we go. And we'll put it in the bottom. And then we're going to fill the tube up about halfway with Ficosol.
Okay, so she did send it out. So usually I just charge for just the send out fee.
And we'll mix that up so it's all homogeneous.
Put it under miscellaneous.
And so like that. Okay, so now we have this filled up halfway. We've mixed it really well. We're going to take another tube, make sure that it is also halfway full so that we can spin it down. So we will spin down this sample for 5 minutes on the fecal setting. And when that's done, we will go ahead and fill it all the way up and put a cover slip on it and wait for 15 minutes before we put that cover slip on a slide so we can read it. Okay, so now our fecal float has finished spinning down. You'll see all the sediment is at the bottom, all the liquids at the top. So what we're going to do is we're going to put that in our holder right here. We're going to take the lid off and take our Ficosol, and we're going to fill up the remainder of the tube until there's a meniscus. We'll place a cover slip on top, and then we will wait for 15 minutes, and we'll take the cover slip and put it on our slide so we can read it. So fill it up. Okay. Put that up. Get our cover slip, and we will put it on top, and we will set a timer for 15 minutes. Okay, so our timer has gone off. It has been 15 minutes. So we are going to get a slide. We're going to take the cover slip and put it on the slide. And now we are going to read our fecal float. So we'll take you. Okay, so now we are going to read our float. Take my goggles off, my glasses. Okay, so we're going to start on the 4X and focus in. I'm going to get to the edge and do pass and sweeping motion up and over, down and over, up and over, down and over. Not seeing anything. Very small amount of debris, but otherwise looking pretty boring. ova present, one hair, and a couple pieces of plant material. But so far that's it. So we're gonna move to the 10x and go back. Opposite direction we were going in. Still not seeing any ova. Okay. Still not seeing anything, so I'm gonna go ahead and move to the 40x. Probably still not see anything, but I can look and see if there's any crazy amounts of bacteria or anything, but I'm not seeing anything. So this slide is like remarkably clear of debris or really anything to look at, unfortunately. But that's only unfortunate for us because I didn't find anything. So we'll let him know that he is all free and clear, and we will go ahead and discuss kind of what we normally see, parasites that we look for in fecals, where they come from, and kind of what they do and stuff like that. So we will discuss in a minute. Okay, so let's talk about some of the intestinal parasites that we see commonly here, some of these gastrointestinal parasites that we see often in the clinic. So the first one I'm going to show you is roundworm. So that's going to be roundworms right there. You can see the ova and the actual parasite. So roundworms are very common in a lot of animals. It's not just dogs and cats. You'll see them in agricultural animals as well. And so also humans can get them. And your pet can actually give roundworms to you. It's not likely, but it's possible. So, and then also just depends on the species. But so there are a bunch of symptoms that you'll normally see with this. So there'll be like diarrhea, vomiting, weight loss, poor coat, no appetite. A lot of times the animals will have really pot bellies. So, you know, you're normally used to seeing puppies with big old bellies, and that's super cute. But when I see puppies with big old bellies, I think parasites. So puppies usually get it from mom. They can get it from her while in utero. And then you can also get it from the environment and from eating other infected animals. So say your dog likes to eat mice or birds in the yard and they have roundworms, it's very likely that your dog will be infected with that parasite. So a lot of puppies, this is probably the most common parasite that we see, period, followed by tapeworms, which I'll go over next. But roundworms for sure we see all the time, and it's said that most puppies, if not all puppies, will have roundworm once in their life. So that, you know, obviously all dogs, but as puppies it's super common. But we see it all the time, and so it's not something we're not accustomed to. But let's go on to tapeworms. Tapeworms, definitely you can transmit to your your family is the from Pet 2 owner. So you can see tapeworms in the same set of animals, and it's definitely transmissible. But it's really, hard because you have to ingest. So you're really not going to get it unless, they've pooped in your food, or they have they're so infested that they've got eggs in your food because they're rubbing their butts everywhere and you've somehow gotten that. It's possible, but it's unlikely. So this is going to be the parasite where everybody calls you and says, oh, there's tiny little worms crawling around my dog's butt, or my dog's scooting around the house and I can't get him to stop scooting. That, of course, could also be anal glands, but it's also sometimes a symptom of tapeworms because the proglottids, or the egg sacs that detach from the actual tapeworms that are in your dog's intestinal system, still wiggle around and everything until they dry out, and that's when the oocytes become transmissible as far as that goes once they're ingested. So everybody says, oh, it looks like little pieces of rice a lot, or they're leaving this all around the house, and they freak out. And I work emergency, and we get a whole lot of people saying that they need to bring their dog in right away for tapeworms. It's not the case. Usually you won't see any symptoms at all unless completely and severely infected. And then, of course, all you're going to see is probably weight loss. And they have to be really heavily infected for you to see that. So not a whole lot of symptoms, except for the fact that you will see proglottids around the dog's anus. And so that's kind of can't miss symptom. And then, so let's go ahead and look at tapeworms. This is a tapeworm egg. And then you can see the tapeworm next to it right here. And those little pieces right there are the proglottids breaking off of this tapeworm. Like I was saying earlier when I was looking at the slide, we sometimes see tapeworm eggs. Not very often do we see them. But occasionally we'll see them. Usually they are diagnosed by just visual representation of them on the dog itself. So, I mean, and you'll see the proglottids in the actual stool as well, not just coming out of the patient. So it's usually pretty easy to see when a patient is infected with tapeworms. So the next parasite we're going to go over is hookworms. So I'm going to show you that now. That's a hookworm right there, the egg, and that's the actual hookworm. So hookworms can be given to any person, so it's not wise to walk barefoot. This is a big reason why you shouldn't go barefoot everywhere, walking in grass and stuff like that. So hookworms are big in dogs and cats and people, and they can definitely give, your pets can definitely give hookworms to your children if they're all using the same backyard. So what you're going to see as far as symptoms, it doesn't take too many, but once completely infested, it's hard to fight, but you'll get anemia. We'll get kiddos that come in with hookworm anemia, and it's gotten to a point where, yes, we're treating the hookworms, but the anemia is too great for the body to compensate, so we have to do blood transfusions in order for them to survive. You'll get pale gums, weakness, weight loss, a lot of bloody diarrhea, and with this, if it's not caught early enough or you're unable to afford transfusions, sometimes it's so severe that the pet may actually die from this. And then this can be transmitted in your utero as well, in puppies, as well as through the milk in the mom. The mom could give her puppies hookworms through the milk. You can also get it by digestion. So, your dog goes to the dog park, eats some other dog's stool. They're infected with hookworms. Now your dog's infected with hookworms. Here's the real kicker. When your dog comes home, they use the backyard and they potty back there. This parasite is transmissible by contact as well. So this particular parasite can also go in through the pads of your dog's feet. That means that this can also go into the bottom of your feet and your children's feet, your hands, any kind of skin-to-skin contact. Your hookworms can get in through there as well. So it's a big deal if your dog has hookworms and they've been using the backyard and you let your children play out there. It may be worth getting a fecal sample and sending to your primary care physician to make sure that your children also don't have hookworms. So the next one, as far as worms that I'm going to go over, is the whipworm. So I'll show you the whipworm right there. And that's the actual worm. That's the ova. We can always tell because it has that football shape. So whipworms, you usually are going to get with whipworms, you're usually going to get bloody diarrhea, watery stool, vomiting, weight loss, and this is only transmitted through ingestion. So the dog has to ingest this, whether it be off of a stick, fecal sample, or just grass. The only really good thing about this is that it's not transmissible to anybody else. This is a dog only or canine only parasite, so you don't have to worry about your children getting this or you walking around barefoot or anything like that. So that's really good. They're not hard to Okay, so the next one that we're going to check and look at is coccidia. This is actually a protozoa, but it is pretty common in puppies. We see a lot of it in congruence with our parvo cases, and usually with like really immune compromised or much older dogs. So that's coccidia. That's coccidia right there. And as you can see in the inside, they have this kind of like double nucleus. So that's, really what you can use to determine if that's coccidia or not. It can sometimes look like hookworms if you're not paying attention. However, coccidia is much smaller, and it does, like I said, have that double kind of nucleus shape. And hookworm, you're going to see like a whole bunch of different globular shapes in the middle, not just two. So coccidia, like I said, is a protozoa, and it's transmitted by ingestion, just like everything else that we've talked about. But so coccidia is, like I said, a protozoa. It's transmitted by ingestion, and you're really not going to see many symptoms of this unless, like I said, you are a puppy or immune compromised or an older dog. So what will happen, and if you work in the veterinary field, you'll come to know what coccidia smells like. It's kind of like HGE when you smell it, parvo when you smell it. So it's just one of those things. If the puppy has, or the dog in general, if the dog has an abundance of coccidia, what it's going to present as is vomiting, really liquidy, watery, tan or beige colored diarrhea, weight loss, and it can be fatal, but that's probably from dehydration, just like parvo. So you won't really see this, like I said, unless their systems just aren't really able to fight against it. So you're going to see it in our younger and older dogs. And then the last parasite I'm going to go over is going to be Giardia. Now, mammals can get this, birds can get it, and amphibians can also get this. So it's transmitted by ingestion, and it will cause this animal, whoever has it, to have diarrhea, vomiting, poor coat, lack of appetite. So I'm going to show you what a oocyte of a Giardia looks like, and then what sometimes we'll see Giardia and you can actually see it moving around. So that's a Giardia cyst, and then that right there is what we usually see as Giardia. You'll see it moving around, swimming around in the actual float sample. But yeah, it's not super common here. I'm unsure if it is more common in Giardia is not very common at our practice and our location. So it's one of the more rare things that we see. Overall, I think we see coccidia, roundworms, and hookworms across the board. Tapeworms, of course. But as far as doing fecals and seeing those ova, I'm definitely going to go with seeing coccidia, which is not an ova, it's not an ova, it's a protozoa, but seeing hookworms, roundworms, and coccidia is what we usually see a whole lot of the majority of the time.